Good morning, everyone. I'm Dr. Minal Bhujangra Wagmare in the series of Disease of Field and Horticulture Crops and their Management. Today, we are seeing some horticulture crops. We have covered diseases of mango in earlier lecture in part 1 up to spongy tissue. Now, we are going to see the remaining diseases of the mango. So, it's a mango part 2 series we are seeing. Coming to our first disease, that is red rust. Causal organism is a Cephalorius virescens. It is a algal disease that the disease red rust is caused by the algae. In this, rusty red and velvety spots appear on the leaves and petioles and some young twigs. So that we can see here, these rusty red spots are appearing on leaves as well as on fruits too. Later, these spots get converted into brownish in color, and eventually that get collapse and lead to the lowering to the rate of chlorophyll as well as lead to the lowering rate of the photosynthesis. Eventually, defoliation, that is leaf dropping, is takes place and it impact the yield. In their management, we can go for the borax mixture 0.6% and copper oxychloride 0.25%. That is 2.5 gram per liter. Coming to the next disease, that is pink disease of mango. Now we are seeing these are some minor diseases, but in competitive it can be asked. So causal organism is a Botryoidbasidium salmonicolor. It is a fungal disease, and we can see that mainly whitish and pink color mycelium web appear on the stem. Many times we will see in a mango plantation web, kind of web appearance can be seen in some stems and leaves. That is especially at the branches junction. So if we find silky white and pink mycelium of the fungus, that is the symptoms of the pink disease of mango. We can also see that due to the this pink disease of mango, Botryoidbasidium lead to the cracking of the bark, and once that bark is cracked, here we can see splitting of bark and cracking of bark is occur, and peeling of this cover is easily takes place, and from this cutting point, or that is splitting point, oozing of the gum is takes place. So some at severe stages also some branches shows the dieback appearance. That is nothing but the that branches are to get dry from tip to the brown in. So we see such that drying of the twigs from top to tip of the twigs to the bottom side, that leads to the dieback appearance of the plant. We also see some girdling canker form. Girdling, it means that continuous lesions are formed in a round circle around the stems, and which lead to the ultimately cutting and cutting of that stem or the twig or branch, and due to this it disrupts the nutrient flow of the plant and lead to the defoliation and lead to the death of that branch. In this, secondary infection get transferred by conidia, and it can be enter in a plant through wounds or from pruning, insect damage, or from natural opening. Coming to the management, in general, we should remember that most of the horticulture crops, management is basically we mostly do the pruning. What is pruning? We will remove or cut the infected branches or twig at the by cutting that branches at below the site of infection up to 7 to 10 centimeter. And if you do the pruning, after that if you apply any copper based fungicide, it will show effective management for such diseases. Coming to the sanitation, we have to clean the plantation, remove the fallen leaves and infected wood. Coming to the fungicide spray, we have to apply the copper-based fungicides such as boric paste and other protective fungicides, that is hydrocide and thyrite, at cutting end and infected area, and especially after pruning. We have to improve the airflow by pruning to the tree, open up to the canopy for better ventilation. If you are doing proper pruning of the plant, unnecessary branches and twigs or infected twigs get removed, and it allows the proper air circulation and ventilation inside the plant, and which also help to reduce the humidity of the plant. If the rain is occurring, then it reduces the chances of the infection of the pathogen also. Coming to the next disease, that is Loranthus giant mistula or benda. Loranthus is scientifically named as a Tetraphil pulcata. We all know Loranthus is a semi-serious semi-stem parasite. What is meant by semi-stem parasite? Because this Loranthus having own chlorophyll, but for nutrient and water, it depends on the another host crop, such as mango. And this is kind of cancerous infection on the main plantation, that is on mango, because it will suck their water and nutrient with the help of Hosteria, and it will lead to reduce the growth and yield of the main crop, that is mango. So what are the major symptoms? It will suck the vital water and mineral from the tree, that is mango, and due to this lead to the stunted growth and poor flowering and lower the fruit yield of the mango. It also, due to it used to grow very vigorously, it also help to block the sunlight and affect the photosynthesis of the mango crop, and it also reduces the aesthetic quality of the tree, which generally unpreferable by the customers, and it also reduces the fruit quality. Coming to the management, yes, we have to go for pruning. That it nothing but the removing of the branches and twigs having the Loranthus infection, and at below the site of that infection, up to 7 to 10 centimeter or 15 to 10 centimeter. Because pruning will help to remove such a parasitic growth of the Loranthus from the plant. We have to remove the infested wood, that is disposal of the pruned wood to the prevent the regrowth. Properly uh, disposal of the infected wood also necessary. We have to keep the surrounding tree clean of the Loranthus. We have to control the bird, because we all know Loranthus have high seed rate and bird used to spread their seed. To managing the birds also have to manage such a Loranthus uh, growth on the mango, because the Loranthus has a high seed rate. If birds will carry it as a vector, then it will definitely lead to the infection and spread of the dissemination of the that seed from one place to another. Coming to the chemical, specific chemical is not still got reported, but yes, it is a Loranthus and semistem parasite. We can go for the herbicide like glyphosate and diesel at the point of attachment, but this require a care. Coming to the next disease, that is stone graft mortality of the mango. Many times when we used to go for grafting, immediate after grafting or sprouting, before sprouting, within a few days only that stone of the mango get dead, under appearance to the death. That is immediate after the grafting or sprouting, before the sprouting only, within a few days only that stone lead to the death. That only called as a stone graft mortality of the mango. So, why it will happen generally, we have to see first that what are the causes. If we choose we choose very old or very young rootstock for the grafting, it definitely reduces the chances of the surviving of the seedling. If we are doing such grafting in very highly dry media like leaf manure only, then proper moisture is not provided to the after grafting. We used to wrap the graft under the uh, moisture media, right? So if you are doing grafting in such a very dry media like leaf manure or not, shoot rot, so in such a media also lead to the stone graft mortality of the mango. And excess heat and excess temperature also lead to the stone graft mortality of the mango. Coming to the symptoms, what are the symptoms? That yellowing and wilting of the leaves and followed by the drying of the entire shoot of the plant is one of the important symptoms. Coming to the lesions, that on stem we find the dark brown and black color lesions appear on the stem just below the soil line, which can girdle and kill the plant. Coming to the another symptom, that is shoot and leaf blight, should become dark and shrivel from tip downward and lead to the lip dropping, that is defoliation. We also find sometime in stone graft mortality, some fungal growth also lead to the stone graft mortality of the mango, and that fungus is nothing but the Rhizoctonia solani. This affect the stone of the mango, and it also showing some resting structure such as sclerotia. So, sudden death also takes place. Younger tender graft are highly susceptible and can die quickly once infected. So, we have to take care that while grafting, we have to we have to care that young grafting should be done in proper media, and proper root stock should be used for avoid this disease. Coming to the management, rainy season offer the highest success rate to avoid this disease, and rootstock selection should be proper. We have earlier seen only very old and very young rootstock. If we use, it lead to the stone graft mortality. Proper media, excess drying manure or FIM only we use, it lead to the drying for that grafting and lead to the death of the uh, stone. So proper mixture of soil, FIM, leaf mold promote the better root growth. So proper media is necessary. We also during grafting we should can go for use of coco peat, because coco peat used to absorb the moisture and it allowed to reduce the drying reduce the drying of the media. Coming to the humidity, cover the graft with polythene bag to maintain the high humidity or moisture. In short, we have to control the pests such as termite, and which for that purpose we can go for the spray of the fungicide and nematicide if needed. Site selection, that we already see proper temperature and humidity are crucial to avoid the stone graft mortality, because excess temperature and excess high temperature lead to the disease, lead to the problem of stone graft mortality. So ensure the proper cambium layer matching with the right, like it means cambium is the main tissue which is important for the grafting. Success of grafting is depend on the cambium itself. So we have to ensure the cambium layer matching should be proper between the cyan and stalks to avoid the stone graft mortality. Coming to our last disease of mango, that is Lime-Induced Chlorosis of mango. So this disease actually occur due to iron deficiency, but how come? Many times our soil is a calcareous carbonate. It means alkaline in condition. Excess calcium carbonate or lime present in the soil. These things makes that iron should unavailable to the plant, such as mango. It means excess calcium carbonate present and lime present in the soil. It lead to the unavailability of the iron to the plant, and that's lead to the iron deficiency for the mango. And this lead to the Lime-induced sclerosis of the mango. Coming to the symptoms, we can see interveinal chlorosis. What it means? Veins will remains green and a remaining portion of the leaf become yellow. Okay, and this lead to the stunted growth, dieback, that is drying of the twigs and branches from the tip to the bottom, and poor quality of fruit, and eventually tree decline due to poor iron and manganese uptake in the alkaline soil. Coming to the management, we have to go for the applications of foliar spray applications of the iron related content such as iron sulfate and iron nitrate, because this disease is occurred due to the iron deficiency. Coming to the soil application, we have to apply the iron chelates directly to soil via irrigation system. Cultivar selection, choosing the mango variety tolerant to the high pH soil or alkaline condition of the soil. And we have to try to manipulate the soil in acidic condition. We can go for the new technique, that is Culton, that is controlled uptake long-term ammonium nutrition. What we used to do, we used to apply the ammonia-based fertilizer at the targeting root area only. Because of supplying the ammonia-based fertilizer, it enhanced the uptake of the iron and increase the acidity of the soil also, which is help to manage the Lime-induced chlorosis disease of the mango. So like this, we have covered all important diseases of the mango. If you like this video, please subscribe my channel and like my all videos, and thank you.